Hello, I'm Luciana Spracher, Director of the City of Savannah's Municipal Archives. Today I'm excited to bring you another little history bite, shining a spotlight on one of our lesser-known city employees from the past. As part of our Hungry for History series, our history bites are intended to give you a little taste of local history in your busy day. Today I'll be telling you about Jane Vrede, and I think afterwards you will agree she was something of a dynamo. At the time of her passing in 1972, numerous organizations showered her with praise. This quote caught my eye. It's a little over the top, but it takes us back to where it all started between Miss Jane and the city of Savannah. No one realized the reason for the radiance of the sun on that day in 1908 in Savannah, Georgia, but we have since come to know that it was due only to the arrival of a Wisconsin nurse who had decided to make Georgia her home. No native-born Georgian has contributed more to nurses and nursing in Georgia and the South than this Yankee nurse from Wisconsin. In 1907, the year before Jane came to Savannah, Dr. W.F. Bruner, the city's health officer, presented 3 resolutions for consideration to City Council, coming jointly from the Board of Sanitary Commissions, the Chatham County Medical Society, and the Savannah Chamber of Commerce. The proposals were in response to a typhoid outbreak and included establishing a bacteriological lab, prohibiting the keeping of cows in town, and prohibiting the sale of milk from residences, which they claimed were responsible for both the origin and the spreading of typhoid fever. City Council passed a public health ordinance in early 1908, establishing the position of city bacteriologist and an allocation for a new lab to serve as, quote, an aid to the control of public health and for the study of problems of sanitary science. City leaders held an examination simultaneously in Savannah, New York City, Chicago, Washington, D.C., and New Orleans. As a result, Dr. Victor Hugo Bassett, who took the test in Chicago, was selected. Bassett was the resident pathologist and assistant superintendent of the Milwaukee County Hospital. In Savannah, he outfitted the new lab on the 3rd floor of City Hall for bacteriological, chemical, and pathological examinations and experiments. Equipment included an autoclave, sterilizers, incubators, a centrifugal machine, and a photographic outfit for making records. In its first 3 months of operation, the lab conducted over 400 tests for diphtheria, typhoid, malaria, rabies, and hookworm, as well as testing water, milk, food, and ice. I first learned about the lab back when I was studying City Hall's construction in its first 100 years for its centennial in 2006. At that time, I was fascinated at the idea of a science lab in the building, right on the 3rd floor, where I had been going to pick up my paycheck, and perhaps overlooked one of the most important details of this new setup, that being Miss Jane Vrede, Dr. Bassett's lab assistant from Milwaukee. Bassett hired her to join him in Savannah to assist with record keeping and managing the workload. When I went back and looked at this very cool photograph through a different lens, the presence of a female in the photograph and the office becomes the most important thing in it. When City Hall was built and opened to the public in 1906, they had 2 separate receptions, one in the afternoon for women and children, and a separate one in the evening for men. The building was outfitted with large multi-person bathrooms on almost every floor. Every single one of them featured urinals. It was clear that when the building was constructed, it was not anticipated that women would be working in it, and in fact would only be very occasional guests of the men. With that in mind, this image of Miss Jane working in the City Hall lab in 1908 likely represents the first professional woman employed in City Hall. As such, we've long wanted to give her a spotlight, not just for blazing a trail within our own building, but for all her accomplishments blazing a trail across Georgia. Once we started looking at her, she quickly came out from beneath the shadow of Dr. Bassett. Let's take a step back and look at Jane's beginnings. She was born in 1880 in Wausau, Wisconsin, and named originally Jenny. Her parents were Dutch, but unfortunately they both died during her childhood, leaving Jane and her 4 sisters orphans. They were separated and reared by different relatives, but remained close throughout adulthood. Jane worked in a family friend's home in town in exchange for 3 years of room and board while she completed high school. She originally intended to be a teacher, graduating from the local teacher training program in 1899 and then teaching for several years in the public school system. At some point as a young adult, she changed her name to Jane, telling friends later that she had believed Jenny to be childish. I'm going to refer to her as Jane or Miss Jane, as she was affectionately known not only by close friends and associates, but by the postman, groceryman, preacher, banker, county commissioner, and all the neighborhood children. Miss Jane's path in life took a dramatic detour at the age of 23, when after suffering an accident, she was sent to a Chicago hospital for surgery, which led to a post-surgical hemorrhage and infection. She was deeply impacted by the negative conditions in the hospital, including bug infestations and poor nursing. One particular event stuck with her for the rest of her life, as recounted in a letter she wrote in 1926. Quote, "Are you the Miss Burgess that back in 1903 was in the Illinois training school and came into the room of a girl on the corner of the then new part of the Presbyterian Hospital, room 208, and said one noon as you put on your cap, 'It's a weary world, and none of us gets out alive.' That made a great impression of me about to go to operation." I would certainly say so. Talk about a bad bedside manner. In another telling of the story, she remarked that she came away thinking that, quote, "Nurses ought to be as understanding of the patient's mind as they are of the body." That experience caused her to switch from being a school teacher to pursue a career in nursing. She applied to the Milwaukee General Hospital School of Nursing and was initially refused admission because her hair was short, the result of her long braided hair being cut during her extended hospitalization. The principal told her that she could not accept her because she had short curly hair and, quote, "Nice girls do not cut their hair short." As she was leaving the principal's office, the woman stopped her and asked her what she had done with her braids. Jane had kept them, and the principal told her to have them made into a switch or a hairpiece and, quote, "Do your hair up like a lady and come back to see me." When Jane did, she was admitted into the school. It seems ironic and incredible that she was almost barred from nursing school by something so minor that was also the result of her illness. After graduating from nursing school in 1908 at the age of 27, she became Dr. Bassett's lab assistant in bacteriology at Milwaukee Hospital. Jane followed Dr. Bassett to Savannah and worked for the city from 1908 until 1917. By 1914, she was listed as the assistant city bacteriologist, no longer just the assistant to the city bacteriologist, a minor but important distinction. Jane apparently was a bundle of energy, and in her spare time taught bacteriology at local nursing schools, engaged in Red Cross work, and began to become involved in the Georgia State Nurses Association. In 1912, she met Jane Delano, founder of the American Red Cross Nursing Service. She was greatly influenced by Delano's work and soon became a Red Cross nurse. In this capacity, she helped organize Red Cross chapters up and down the Georgia coast and taught class in topics like surgical dressings and home nursing. In fact, she was the first to teach the course in home nursing in the entire state of Georgia. Jane worked for Bassett in Savannah until 1917, when she was offered a position in Atlanta as Director of Nursing Service for the Southern Division of the American Red Cross. In this capacity, she had a 5-state territory. In 1925, the Southern Division was transferred to the headquarters in Washington, D.C. Jane was offered a promotion to D.C., but declined it in order to stay in Georgia, to follow through on work that she felt was essential to the health and welfare of the people and to the advancement of nursing in Georgia. During World War I, in an attempt to recruit nurses for military service, she visited hospital schools of nursing and found many nurses unqualified for Red Cross service because of their limited education and clinical experiences offered by these small schools. These experiences sparked her motivation to later provide leadership and accreditation efforts through the Georgia State Board and the Georgia Hospital Association. It was also during her time working for the Red Cross that she identified a lack of schools in the South that addressed public health. In the words of the CDC, public health is the science of protecting and improving the health of people and their communities. The work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious disease. Overall, public health is concerned with protecting the health of entire populations. These populations can be as small as a local neighborhood or as big as an entire country or region of the world. Jane recognized that the public health nurse was in a unique position to help. They were accepted by the population, have the ability to teach prevention, and they keep in mind the impact of environment, previous conditions, and social causes on illnesses. However, she also noticed that few nurses were prepared for the preventative aspects of public health. At that time, the only public health schools were in the north, and they failed to address the particular problems of both southern and rural health. Through her perseverance, or pushiness, depending on how you want to look at it, a new public health nursing program was established at Peabody College in Nashville, with the college contributing $40,000, the Nashville Red Cross chapter $40,000, and the American Red Cross $20,000. This would be over $1.7 million today, so no small feat for our Jane. Students studied public health theory and completed clinical practice in the surrounding rural areas of Tennessee. A similar program was set up at the Medical College of Virginia in Richmond for Black nurses, with Lillian Bishop as the first director, and that name will come up with us again later. During the 1920s and 1930s, Jane focused on the establishment of higher education standards for Georgia nurses. During her career, she served as either president or on the board of directors of nearly every organization concerned with the nursing profession and its improvement. She was appointed continuously from 1914 to 1933 to the Georgia State Board of Examiners of Nurses, and served as both their first educational supervisor and the executive director. One biographer remarked, "Nowhere was her achievement greater or its value more permanent than in her work with the Board of Examiners." She first became involved with the Georgia State Association of Graduate Nurses when she moved to Savannah in 1908, and over the years she served as president, executive secretary, vice president, secretary, treasurer, parliamentarian, and chaplain. As a founding member and the first president of the Georgia Hospital Association, she sought the cooperation of affiliate hospitals to ensure quality nursing care and educations in hospital-owned nursing schools in Georgia. The Georgia General Assembly had created the Georgia Board of Nursing in 1907, and the board was tasked with regulating the growing field of registered professional nurses and overseeing nursing education programs. The board worked to improve the written exam, establish minimum pass rates, and expand the content areas, including such topics as dietetics, obstetrics, and physiology. By 1928, there were approximately 2,500 registered nurses in the state of Georgia. Up until 1940, the board's work consisted primarily of developing and administering the exam and regulating nursing programs. But in 1940, they revoked 2 licenses and faced an increasing number of disciplinary actions. So in 1946, the board requested the Secretary of State to create an enforcement office that it could assist the board in conducting investigations regarding complaints submitted against licenses. Their request was granted, and in 1947, Jane was appointed as the inaugural enforcement officer with a salary of $200 per month. By the following year, there were over 12,000 registered nurses in Georgia, a growth of over 480% since the 1920s, indicating just how large a task Jane had. As a result of the Depression in the 1930s, Jane became engaged in one of the biggest and perhaps most satisfying undertakings of her career. At the invitation of Harry Hopkins, director of the Civil Works Administration, she assumed the position of Director of Women's Work in Georgia, where she felt she would be able to do more for nurses who were becoming increasingly among the unemployed. As a result of her leadership, 593 nurses were employed in various health projects, and so successful was the visiting nurse service in maternity and infant welfare that practically every county in Georgia was included. As a result of this, public health nursing in Georgia was developed within the State Department of Public Health. Her oversight wasn't limited to nurses, and in 1934, there were 3,500 women employed in the program in sewing, clerical, and library projects, as well as women working on the federal farm home surveys. This work also made her a target of Georgia Governor Eugene Talmadge. Talmadge opposed relief programs, and specifically federal relief. He fired Jane on the grounds that she wasn't a native Georgian and therefore could not understand Georgia problems. Hopkins then threatened to shut the whole program down in Georgia, which resulted in a wave of backlash from people who were afraid Georgia was going to lose its works program. Hopkins used that as an opportunity to federalize the program and cut Talmadge and his appointed board out of the loop. He then reappointed Jane, and she worked for the WPA until 1942. Jane's contributions covered a wide range of issues related to nurses and the profession. As a member of the American Nurses Association Board of Directors, she was an active promoter of the Harmon Association and its plan of insurance and savings for nurses. She was effective in collaborating with physicians and assisted in pushing nursing-focused legislation forward. She was spokeswoman to various medical groups, including the Southern Medical Association, the Medical Association of Georgia, and the American College of Surgeons. As chairman of an ANA committee to promote cooperation and understanding between the American Nursing Association and the National Association of Colored Graduate Nurses, Jane helped facilitate interracial communication and planning among Black and white nursing organizations in the segregated South, helping to pave the way for these two organizations to later become one. This chairmanship was very important to her, as she felt strongly that there should be only one organization where all nurses work together for the betterment of the profession. A little tangent that my research took me off on was related to the role of lesbians in the advancement of the nursing profession. Nursing was one of the few professions that allowed women to live financially independent from men, and as such, you see a number of leaders in the nursing, social work, and public health fields. While historians have categorized Jane as a lesbian, she may not have identified as such. She lived with Lillian Bischoff, who you might remember was the director of the Medical College of Virginia's nursing program. One biography noted that Lillian Bischoff not only loved her and cared for her, but was sensitive to her need to exercise an alert mind. I think we would all hope to find someone who would help exercise our minds. Jane lived with Lillian in a house in Smyrna, Georgia that she had designed. She was blind the last 5 years of her life and passed away in 1972 at the age of 91. She was immediately recognized for her accomplishments and contributions to the nursing field and to Georgia. Bischoff donated her personal papers to the American Nursing Association's archives at Boston University. The Georgia State Nurses Association dedicated their boardroom to her. The Georgia State League for Nursing established the Jane Van Vrede Award to recognize outstanding service improving the delivery of health care in Georgia, an award that is still given out. And in 1976, the governor declared Jane Van Vrede Day to coincide with an exhibit on her life and work mounted at the Georgia State Archives. Just as a little aside, I thought it would be interesting to share the titles of some of her papers, which reflect the arc of her career, from teaching bacteriology to encouraging the public health nurse in the South to fostering cooperation between doctors and nurses. Her personal papers also include an unpublished manuscript titled A History of Nursing in Georgia, which should probably be distributed. Jane's life and work not only uplifted nurses and the public health profession, but improved the status of women, breaking through prescribed sex roles and the institutionalized segregation in the South. I hope you enjoyed learning about Miss Jane, Georgia's public health dynamo. We'll see you soon for another History Bite.